I'm Dr. Alok Modi. I've done my specialization in internal medicine from KM Hospital, CGS Medical College, Long Back. I have been an associate professor of medicine at Sri Rajiv Gandhi Medical College and Chhatrapati Shivaji Hospital in Thane. Currently, I'm practicing in private with my own hospital and Dr. Alok Modi's Diabetes Center in Kevalia Hospital. I'm also attached to Jupiter Hospital, which is a corporate hospital in Thane. My field of interest relates to critical care and diabetes for the last few years. I would like to thank Dr. Vitul and his entire team and the organizing committee of MAPICON Bathinda for giving me an opportunity to come as a faculty, and I would be talking tomorrow, and my talk consists of psychosomatic diseases and psychosomatic aspects of diabetes. Now that's a very interesting topic because we deal with a lot of diabetes. Diabetes, as you all know, it's a big problem. It's a non-communicable disease. India is the second leader of diabetes in the world today, and that's something very sad. And the entire health industry and all the top diabetologists in the country are working very hard to get the incidence down of diabetes in India, because it's a malady which I think is bigger than cancer also. As far as India is concerned, we see a lot of young diabetics who are suffering from diabetes, and that's a very sad thing that we are developing diabetes in the young population. Recently, we've started seeing a lot of patients who are developing pre-diabetes. Now, pre-diabetes is a nomenclature which is going out as per the International Diabetes Forum, because pre-diabetes has equal amount of complications that a diabetes patient has in the long run. So the topic that I'm focusing on tomorrow is the psychosomatic and the psychological aspects of diabetes. Now, why that is relevant is because I have publications in the international forum, and this year also I published a paper in American Diabetic Association with my co-authors, where we very clearly shown that getting the patient's psyche under control, getting them to exercise and changing their lifestyle with a good food habit, which is monitored by a health professional, makes a starking difference in the outcome of sugar profile. The HbA1c comes down and the lifestyle improves significantly. There are a lot of other issues in psychosomatic problems with diabetes, like failure of erection, failure to take insulin, and the scare of morbidity and mortality with diabetes, complications arising because of neuropathy. We don't address these issues. We as health professionals are very busy. We are happily writing prescriptions to our patients. We're doing a wonderful job in getting their sugars under control. We're also doing a wonderful job in looking beyond sugar control in diabetes, like nephropathy, cardiomyopathy, retinopathy, etc., etc. And we look into that and focus on that. The CBOT team, which is started from the last, which focuses a lot on the cardiovascular outcome studies and data in a diabetic. As we all know, most of the diabetics die because of a high and early incidence of coronary syndromes, heart failures. There's a huge overlay of early kidney failure, incipient microalbuminurias and all in diabetes, which cause a huge amount of morbidity and mortality in diabetics. So we are all very skilled and adept in doing that, and fantastic work is done all over the world, including India, on taking care of these issues, which I call is looking beyond sugar control in diabetes. But something which we need to look even beyond that is the psychological part. Do our patients take medicine properly? Are our patients happy with the medications they are on? Are our patients happily managing their diet and managing their exercise routines that they should manage with a lot of happiness? Are they happy taking insulin? What is preventing them from talking to their doctor? A lot of patients have hypoglycemia. They don't come out to their doctors with symptoms of hypoglycemia in the faith that the doctor would slap another insulin or some other medication on them. Many patients don't tell them that their performance at work is going down, that their grades are going down, and they're not doing well because of morbidity of diabetes. So all these issues need to be taken care of. So we would be discussing that tomorrow. Finally, I would like to thank the organizing committee for giving me this opportunity. I'm coming to Bathinda for the first time. It's a nice hotel and it's a beautiful conference. I'm very happy to share it as with such esteemed faculty who've come for this MAPICON, and I'm looking forward to a very lovely conference, and I'm looking forward to learning a lot in diabetes and enriching my knowledge and passing it on to my patients in the days that I'm here, that is today and tomorrow. Thank you very much for this opportunity.